Yeah.
Yeah, you can.
Good evening, everyone. I think we're going to get started in just a few moments here. You'd like to take your seats? Good evening, everyone. Bonjour, Kwe. Starting the meeting from over here this evening. But thank you all for being here. I want to begin today's meeting by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. This land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. In the spirit of true reconciliation and as chair of the Board of Health, I commit to continuing to work with staff and local community associations as they explore how reconciliation can be embedded into community-led initiatives and events, and to continue to look for opportunities to spotlight a variety of programs and events throughout the year, but especially in June as we honor National Indigenous History Month, a time to learn about the unique cultures, experiences, and achievements of First Nations, Inuit, and Métis people. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health, equity, and self-determination of all Indigenous people. This evening, we're going to begin with a special ceremony, as it is National Indigenous History Month, and National Indigenous Peoples Day is coming up on June 21st. We are honored to welcome First Nation grandmother Irene Compton and Métis Senator Parm Berge to offer opening prayers. So we will begin with Senator Berge, if you'd like to come up to the podium.
Thank you. I accept.
you'll join us again. We always appreciate your visits. Thank you. I'm gonna just go over there and we'll resume the meeting from there. Thank you. Okay, so we will proceed with the roll call, please, Madam Secretary.
Member Banham,
Present.
Member Bauer,
Present.
Member Brown Shreves, Member Carr,
Present.
Member Chung,
Present.
Member Dudas,
Present.
Member Gower,
Here.
Member Kavanaugh,
Present.
Member King,
Here.
Vice Chair DiGiovanni,
Present.
Chair Kitts.
Yep.
We have quorum, Madam Chair.
Thank you. We have no regrets expected today. Are there any declarations of interest?
Yes, from Member
There
Chung
is
here.
one. Oh, Member Chung, please.
Yes, in relation to the motion for support for wastewater surveillance.
Great, thank you. Confirmation of minutes of the meeting of April 15th. Was received or confirmed? We have 4 communications items that have been received and are held on file with the board secretary. Motion to introduce reports. Member Carr, please.
Be it resolved, the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Ottawa Public Health 2023 Annual Report, Ottawa Public Health's Strategic Plan for 2023 to 2027, Update on the Strategic Action Plan, Ottawa Public Health Approach to Infectious Disease Case and Contact Management, and 2024 Operating Capital Budget Q1 Board of Health for the City of Ottawa Health Unit Status Report and Cybersecurity at Ottawa Public Health Presentation in camera item to consider the security of the property of Ottawa Public Health be received and considered.
It's received. Thank you. Okay, so we will go through the agenda. Item 8.1 is my verbal report, which will be held. Item 8.2, we will hold for a medical officer of health verbal report. Item 8.3, Ottawa Public Health 2023 Annual Report. Is this received? Thank you. Item 8.4, Ottawa Public Health Strategic Plan for 2023-2027, update on the strategic action plan. We will hold this item. We have a couple delegations. Just one. Item 8.5, Ottawa Public Health Approach to Infectious Disease Case and Contact Management. We have a staff presentation. Item 8.6, 2024 Operating Capital Budget Q1 Board of Health for the City of Ottawa Health Unit Status Report. Is this received? Great, thank you. And then item 9.1 will be an in-camera item. We have a cybersecurity presentation, so we'll go back to that as well. So item 8.1, my verbal report, settle in. It's a little lengthy this month, but there's lots going on, as I'm sure you all feel. So Kwe, Anin, Shekan, Tanshi, Unukut, and good evening, everyone. Thank you all for being here this evening, and special thanks to Elder Compton and Senator Berge for opening our June Board of Health meeting in such a special way. June is National Indigenous History Month, as mentioned, and June 21st is National Indigenous Peoples Day. Both are opportunities to reflect on and celebrate the rich and varied histories, heritage, traditions, cultures, stories, and outstanding achievements of First Nations, Inuit, and Métis peoples in Ottawa, while learning how the significant contributions of Indigenous peoples have shaped this country. It is also time to reflect on and acknowledge our shared history, most importantly, the legacy and ongoing impact of colonization on the lives of Indigenous peoples. Understanding the historical and contemporary context of First Nations, Inuit, and Métis people, including the local diversity, strengths, and successes, is a critical step to a better future, one where every person lives with dignity, value, and purpose. While this month provides us with many in-person and online opportunities to listen and learn with humility, it is critical that we continue to do so throughout the year. With this knowledge, we can act with purpose to address the many injustices that Indigenous peoples have experienced and continue to experience in Ottawa and beyond. Je vous encourage tous à explorer les nombreuses ressources inestimables qui sont offertes par l'entremise d'organismes comme le Centre national pour la vérité et la réconciliation et le Centre de collaboration nationale de la santé autochtone et à réfléchir à ce que vous pouvez faire pour promouvoir la justice sociale et promouvoir les droits et le bien-être des Autochtones. I would also like to remind you that in the National Capital Region and across the country, there are many events and celebrations occurring throughout the month of June, including on June 21st, to recognize and honor the cultures and contributions of Indigenous peoples. In Ottawa, the Summer Solstice Indigenous Festival will take place at Matahawkee Farm from June 21st to the 23rd. This event brings together Indigenous artists, performers, knowledge keepers, students, and community members to share their knowledge and experience and to celebrate diverse Indigenous cultures. Activities include a competitive powwow, artistic workshops, farm-to-table culinary experiences, Métis and Inuit games, and so much more. Similarly, check out the many activities planned through the Ottawa Public Library and the National Arts Centre. All of this offers an amazing opportunity to support local Indigenous artists and organizations and to learn firsthand about Indigenous cultures and creativity. June is also Pride Month, a global celebration of the history, resilience, and achievements of the 2S LGBTQ+ community. La fierté rassemble des personnes de tous horizons pour honorer l'inclusivité, la diversité, le respect et l'égalité. Year-round, OPH honors the vibrant history of the 2S LGBTQ+ community through health equity initiatives and goals that seek to promote inclusivity, diversity, and acceptance within our community. We continue to stand in solidarity with the 2S LGBTQ+ community and work together to create a healthy and inclusive city that embraces and respects everyone, regardless of their sexual orientation or gender identity. I encourage board members, employees, and residents to visit capitalpride.ca to find out more about ways to show our support for equality and celebrate the contributions of the 2S LGBTQ+ community to our city. As we enter the summer months in Ottawa, we start to enjoy the sunshine and festivities our city has to offer. I want to remind residents of the many resources Ottawa Public Health has to offer to stay healthy and safe during the summer months. While we are grateful for the sunshine and warmer days, certainly this week, we occasionally experience high heat and humidity during the summer months, and it can be hard for our bodies to keep cool and not overheat. Throughout the city, there are many public places residents and visitors can cool off during extreme heat and humidity events, which you can explore on an interactive map on Ottawa Public Health's website. As we look forward to attending the many festivals and outdoor events in Ottawa, please continue to prioritize your well-being and make informed decisions to protect yourselves and others from harm. Ottawa Public Health and Ottawa City employees will be on the ground at many of these events. I encourage you to interact with the employees and ask questions about the many resources and services available through OPH, such as naloxone kits and training. If you suspect drug-related activity or witness anyone in distress, I encourage you to seek help from event organizers or medical professionals immediately. As we think of ways to stay healthy and safe this summer, I think it's timely to discuss the importance of water safety, as I am deeply saddened to learn about the recent drownings in Ottawa, and I send my heartfelt condolences to all those close to the victims. Water safety remains an important discussion at Ottawa Public Health and with the Ottawa Board of Health. As you may recall, the board wrote a letter of support for Bill 93, Joshua's Law, Life Jackets for Life, last year in an effort to encourage preventative measures and protect our community from accidental drownings. This bill has been ordered for third reading. However, the House has recessed and consideration of this bill will resume when the provincial legislature resumes in the fall. Since 2002, Ottawa Public Health has been working with numerous community partners on the Ottawa Drowning Prevention Coalition to coordinate efforts to prevent water-related injuries, incidents, and drownings. Yet the number of preventable water-related deaths in Ontario increased from 176 in 2019 to 211 in 2020. OPH is working to examine systemic factors that may be contributing to this increase and to implement solutions with partners. Vous pouvez trouver plus d'informations sur la sécurité estivale sur le site web de Santé publique Ottawa, notamment une liste détaillée des centres de rafraîchissement, des conseils relatifs à la sécurité au soleil et les risques liés à la consommation de drogue lors de festivals et d'autres événements. En gardant à l'esprit ces questions importantes et en nous associant les unes des autres, nous pouvons faire en sorte que tout le monde passe un été agréable et sécuritaire dans notre ville. I am very pleased to share that last week, OPH launched a mental health addiction and substance use business support toolkit. Safe and fulfilling workplaces are a key part of any healthy community. With the launch of this virtual kit, OPH is offering a one-stop shop for tools and resources to help enable healthy workplaces that support the safety and well-being of staff, clients, partners, and visitors. The Business Support Toolkit features practical resources like who to call and a Find Your Way community resource guides, what to do if you find improperly discarded needles, and where you can pick up a naloxone kit. It also offers self-guided training opportunities to teach employees on how to support and respond when someone might be experiencing a mental health or substance use health issue in the workplace. This toolkit was developed with input and feedback from the business community, including the Ottawa Board of Trade, Business Improvement. You can find the toolkit at ottawapublichealth.ca/business toolkit. I had the privilege of attending the Association of Local Public Health Agencies annual AGM and conference in Toronto from June 6th to 8th. The conference is well attended from public health units and boards of health from across Ontario, giving us the opportunity to hear from many of our colleagues on their experiences navigating the current issues across the public health sector in Ontario. J'ai profité de mon séjour à Toronto pour rencontrer des représentants du bureau du ministre associé délégué à la santé mentale et à la lutte contre les dépendances et l'équipe des politiques de santé de l'Association des municipalités de l'Ontario. At the conference, we heard from Premier Doug Ford, Deputy Premier and Minister of Health Sylvia Jones, and the Chief Medical Officer of Health, Dr. Kieran Moore. The Premier acknowledged that funding for public health needs to increase with population growth and shared his thanks with public health leaders for their work to support the health sector in Ontario. Minister Jones also shared her appreciation for the work of public health and highlighted how we continue to innovate to be responsive to the needs of the population. The Alpha Resolution session showed how public health leaders in Ontario have a common voice and recommendations to better address the issues of vaping, alcohol, food security, among others, were passed. The OPH team will be sharing the specific resolutions with the Board of Health in the coming weeks. Lastly, I would like to congratulate our Vice Chair, Tammy DiGiovanni, who, during the Boards of Health section meeting, was elected to stand as the Boards of Health Eastern Ontario representative on the Board of Health Section's Executive Committee, which includes membership in the board for Alpha. Congrats. I would like to take a moment to speak about basic income guarantee. Food insecurity in Canada is at a record high. 70% of households receiving social assistance experienced food insecurity. Being employed is not a protective factor from being food insecure. As a result of low wages, unstable work hours, and lack of job security, 60% of food insecure households have employment as their main source of income. Ici à Ottawa, l'insécurité alimentaire continue de s'aggraver puisqu'un ménage sur 7 souffre d'insécurité alimentaire. Les programmes qualitatifs d'alimentation locaux ont du mal à répondre à la demande croissante et sans précédent d'aliments. L'insécurité alimentaire est un problème de revenus qui ne peut être résolu par des solutions d'approvisionnement alimentaire. The results from the nutritious food basket survey received at last November's Board of Health meeting clearly demonstrate that improving household income is essential in reducing food insecurity. Income-based policy options such as social assistance rates that are reflective of the cost of living, minimum wage set at the level of a living wage, as well as having a basic income guarantee are all concrete solutions for everyone to be able to afford food, shelter, and other basic costs of living. Right now, Senate Bill 233 and concurrently Private Members Bill 223 are being considered. Should either of these bills pass, the Minister of Finance would be required to develop a national framework for the implementation of a guaranteed livable basic income for all people over the age of 17 in Canada, including temporary workers, permanent residents, and refugee claimants. A basic income is a periodic, unconditional cash payment the government provides to individuals so that everyone can meet their basic needs with dignity. A basic income guarantee can address the growing issue of poverty, the root cause of household food insecurity, as well as homelessness. As Councillor Kavanagh shared in a recent Ottawa Citizen editorial, a guaranteed basic income would solve Ottawa's affordable housing crisis. If there was ever a time to embrace a courageous idea, this is it. Food insecurity and poverty have a detrimental impact on physical and mental health in adults and children. Policies to increase income to those most impacted by health inequities are crucial. I'm hopeful board colleagues will join me in expressing support for Bill S 233 and C 223 for a national basic income guarantee framework. I've asked Councillor Carr to introduce a motion on my behalf.
Thank you, Chair. Read out the motion. Whereas the Ottawa Board of Health recognizes that income is one of the most important social determinants of health and relates to many other determinants, including education and literacy, healthy behaviors, inadequate housing, and employment conditions. And whereas a basic income guarantee program for people over the age of 17 in Canada would meet basic human needs by ensuring the security of a minimum income level, regardless of employment status. And whereas a basic income guarantee program would help to reduce poverty and improve income security in Canada and address the related negative social and economic impacts on the health of our most vulnerable population. And whereas income-based policy measures are necessary to effectively reduce household food insecurity, which is associated with many negative physical and mental health outcomes and is experienced by 1 in 7 households in Ottawa, as outlined in a report received at the November 2023 Ottawa Board of Health meeting. And whereas a basic income guarantee program can complement existing social support systems in Canada in the form of long-standing programs like the Canada Child Benefit and the Guaranteed Income Supplement for Seniors, which have demonstrated positive impacts on basic income recipients, economies, and our greatest society. And whereas the Ontario Basic Income Pilot Project that was tested in the Hamilton area, Thunder Bay area, and Lindsay between 2017 and 2019 saw 4,000 eligible applicants receive basic income and report positive outcomes, including the alleviation of food and housing insecurity, improved physical and mental health, financial stability, social equity, and increased access to employment opportunities. And whereas Bill S 233, an act to develop a national framework for a guaranteed livable basic income, was referred to and currently being considered by the Standing Senate Committee on National Finance after passing second reading in April 2023. And whereas Bill C 223, an act to develop a national framework for a guaranteed livable basic income, was read a second time and remains in the order of precedence in the House of Commons after an initial debate in May 2024. And whereas the call for a basic income guarantee program in Canada is being made by many other boards of health and municipalities in Ontario and beyond, and whereas a basic income guarantee program would align with public health priorities, including to seek to address negative impacts of poverty and improve access to healthcare and potentially reduce healthcare costs, enabling people to afford preventative care and timely treatments while preventing more costly healthcare interventions, leading to better overall population health. Now, therefore be it resolved that the Ottawa Board of Health supports the concept of a basic income guarantee for all people over the age of 17 in Canada to help combat low income and economic vulnerability within our community. And that the Ottawa Board of Health calls upon the federal and the provincial governments to collaborate on the introduction and implementation of a national basic income guarantee program for all people over the age of 17 in Canada. And that the chair of the Ottawa Board of Health write a letter to the government representative in the Senate and the chair of the Standing Senate Committee on National Finance, sharing the board's support for this legislation and calling on these leaders to prioritize the passage of Bill S-233. And that the chair of the Ottawa Board of Health write a letter to the Prime Minister and copy to Deputy Prime Minister and Minister of Finance and the Government House Leader, sharing the board's support for this legislation and calling on these leaders to prioritize the passage of Bill C-223.
That motion carried.
Carried.
Great.
You
Thank
want me to read it in French?
I am almost finished. But before I conclude my verbal report, I would like to share with the board that this will be Member Bannon's last meeting with us before she moves back to her hometown to spend more time with family. I believe I speak for the board in offering Member Bannon our best wishes and express our appreciation for the service and collaboration over the past several years. You brought a great deal of knowledge to the board with your previous experience serving as the executive director of the Ottawa Birth and Wellness Center, as well as your experience working at various levels of government to help shape policy with a focus on health, gender, and mental health. Your passion for health equity and commitment to volunteerism in Ottawa will be greatly missed, and I thank you for your time and commitment to our board for the past 2 terms. A round of applause. And with that concludes my very short verbal report. Are there any questions? Seeing none, is that received?
Received.
Thank you. Now I'll turn it over to Dr. Etches for her verbal report.
Looking at the page numbers, I think you win today. And so to everyone, Kwe, bonsoir. Annie, I know grandmother Irene and Senator Berge have left, but their presence does remind us of the priority to work in partnership with First Nations, Inuit, and Métis community members and agencies on their priorities for well-being. We get great input and instruction from many in the community. I also want to thank you, Member Bannon. Thank you for your dedicated service. We really will miss your questions that are well considered and thoughtful and prompting. I think we really have appreciated and benefited from your work. So I do have a few items. I wanted to talk about the Ontario Public Health Standards. And so right away, I'll invite Cameron to come up to be able to speak to that, or if you're going to do that from where you are, Cameron, go ahead, come forward. And I do want to speak to some changes at the Ontario level in terms of access to alcohol, partnerships that we're making in the downtown core, the 2025 budget planning, and also certainly, I think very important tonight to speak to the extreme heat event occurring this week. So Cameron, go for it then from where you are. He is the Director of Quality, Epidemiology, Strategy, and Technology, and is leading our input into the review of the Ontario Public Health Standards, which, you know, as a board, set out what we're required to do under the Health Protection and Promotion Act.
Thank you, Dr. Etches. Can we please move the slide forward? Thank you. So high-level context is that the ministry's goals for this review are to refine the guidelines to essentially ensure that there's better impact and alignment with the current needs we face in our in the province. As well, there's a goal to refocus, so ensuring that the underlying work and the guidelines align with the desired goals and objectives of the standards. And as well, another goal is to re-level. So this is really looking at public health work and looking to reduce it. And, you know, by things like redistributing workloads, clarifying roles or defining expectations to optimize collaboration with other partners. So this is a pretty significant, ambitious undertaking the province is going forward with, and public health sector was provided the opportunity to provide some insights into what to refine, what to refocus, what to relevel earlier on in the year. And the ministry did start, I think they set up about 16 standard review groups, and we were on many of these groups. Next slide, please. So it's been a little bit of a wait, but 2 weeks ago, the ministry released the new draft guidelines. And this is the latest ministry slide as it relates to timelines and next steps. And with this release of the draft standards, we're now in the consultation phase. And so the ministry is hoping to get most of the feedback from the field via a e-survey. And every organization, public health unit, sort of one per unit. The ministry is looking for this information by June 20th, so this week. They're also going to be conducting some other consultations. They hope to get most of the consultations done in June, July, and as well start the analysis of the consultations and sort of refinement in the June, July timeframe as well. A real focus the ministry has on releveling opportunities. And so they're going to check in June, July as well with the standards review table and public health leadership team made up of provincial MOHs to look at releveling as well. So it's a pretty ambitious, initiative with some tight timelines. They're hoping that by September, this will be finalized for a January implementation. I'm not sure they're going to make the September deadline, but my understanding is they're certainly going to be trying to. Next slide, please. So as it relates to Ottawa Public Health and our feedback, so we've started a pretty robust process to involve our teams to provide feedback for this e-survey. And not at liberty to talk about detailed changes. We're still in early consultation, so it's still very much confidential. But at a high level, they can talk about what we think some of the high-level descriptions of impact might be on OPH. And so looking at our team's data so far, there are some themes that have come out. Number one is that, yeah, for sure, there is a refinement and focus of the standards. Some standards have been removed. Some focus areas aren't there anymore. Some standards have been merged. Sometimes there's a little bit more clarity, sometimes a little less. Sometimes there's some new guidelines and some new standards as well. So for sure there's movement there. When it comes to the workload perspective, that was also a theme that came out. And as I talked about, one of the goals the province had was to relevel workload, public health workload. But so far what we're seeing it's probably not the case yet. Maybe if anything at the local level, workload might actually be a little bit increased with these standards, with these new draft standards. Some of the areas where they have removed, we already weren't necessarily doing that work. We were looking at this from a harm reduction standpoint, and maybe we're focusing more on priority populations and to make larger impacts. And so really, we're not seeing a big reduction, but not all standards yet are part of this review. For example, immunization is not part. And we know in June, July, the province is interested in doing more releveling efforts. So perhaps that will alleviate workload, but we're not seeing that quite yet. Other themes, looks like, to meet the expectations of these draft standards, at times we might need new systems or new data. For sure, more integrated systems is a common theme. Some capacity building and training looks like might be required, as well as some other supports and references and things like that. And Perhaps the last theme coming from this review so far at a high level is just a need for a little bit more clarity. Not all the standards are super clear, especially as it relates to a delineation of roles and responsibilities. So at a high level, that's kind of where we stand from, the context and timelines and where we are with our feedback at OPH. So happy to turn it back to you, Dr. Etches.
Sure, thank you. And we can take questions at the end. So I'll resume by noting, of course, has been in the news that there will be an expansion in the sale of beverages containing alcohol in Ottawa that will start this summer. And we can anticipate that this expansion could be associated with health harms. A Ministry of Health announcements indicated that starting in August, consumers in Ontario will have access to new beverages containing alcohol like coolers and ready-to-drink options at grocery stores that currently sell wine or beer. And cela sera suivi par une sélection accrue de produits alcoolisés chez de nouveaux détaillants. D'ici la fin d'octobre 2024, les épiceries, les dépanneurs et les grands magasins de l'Ontario pourront vendre de la bière, du cidre, du vin et des boissons prêtes à boire. So as these changes roll out, Ottawa Public Health will monitor the expansion's impact on health by gathering and reviewing the available data. We'll continue to collaborate with partners to reduce alcohol-related harms. For example, we'll continue to raise awareness of Canada's guidance on alcohol and health, offer harm reduction messaging, substance use health resources and supports, building capacity of others to speak to these issues, and doing training and promoting resources like the Party Safer course available on stopoverdoseottawa.ca. Additionally, we'll be working with school boards, Rideau Wood Addiction Centre, and Le Cap to ensure that resources, prevention programs, and counseling are readily available through our schools to ensure that youth have the supports they need to support their substance use health. We also recognize that alcohol consumption can disproportionately affect people from equity-denied communities, and so we'll continue to work with our partners from the Community and Social Services Department's Community Engagement Team, as well as many other partners that are involved in partnership and collaborations with equity-denied groups to monitor the impact of expansion and continue to provide connections into treatment and harm reduction programs. We'll also continue to look for opportunities to advance previous policy positions of this board, such as on limiting advertising of alcohol, advancing labeling on beverages containing alcohol, on pricing related to alcohol content, and reviewing the sugar and caffeine content of drinks containing alcohol. Turning to the downtown core, earlier this month, I joined the chair in attending the launch of the Ottawa Board of Trade's Downtown Action Plan. C'était formidable de voir autant de partenaires de toute la ville, notamment de gouvernements, d'entreprises, de la société civile, de communautés et de groupes de santé se réunir pour trouver des solutions et des opportunités pour notre centre-ville. We all know just how important the downtown core is for the city. The challenges it faces are not necessarily unique to the whole city, but the scale of the challenges are unlike any other part of the city. And so this spring, Ottawa Public Health brought together health providers focused in this area of Lower Town, Sandy Hill, and the Byward Market, along with the Ottawa Health Team, Équipe Santé Ottawa, to explore a more coordinated health system redesign, a response to the health needs of residents and everyone in these neighborhoods. I'm happy to say the Ottawa Health Team at Équipe Santé Ottawa has taken on leadership and project management of this work, and we've set out 3 goals: better and increased access to quality health care, specifically primary care and mental health and addictions treatment. We're also aiming to have a more well-connected system of care that addresses the needs of residents and people in the area. And of course, we want to see fewer deaths and overdoses from drug toxicity. And healthcare is only one aspect of what promotes community well-being in the core. We need significant commitments to and investments in safe and affordable housing, social and employment supports, recreational services, and many other. So we'll continue. Ottawa Public Health is part of many of these discussions to put into place such supports in our city. Le succès de notre centre-ville peut être mesuré de plusieurs façons, que ce soit le niveau d'emploi ou encore au dollar du tourisme, en passant par le nombre de nouvelles entreprises. Mais je voulais rencontrer l'histoire d'un partenaire communautaire que j'ai rencontré il y a quelques semaines et qui m'a parlé de ce qu'il considérait comme un succès. A community partner recently described to me how he saw a young family coming into the Byward Market and two of their kids started playing soccer in the pavilion, and eventually other kids and visitors got involved. It seemed as if everyone stopped what they were doing and just admired something simple and joyful happening in front of them. There's a feeling of cohesion and normality. And I think to me, and for many of you probably here, you can imagine this goal for the market and the downtown core, a place where people and families from all walks of life can gather safely, find new connections, and rekindle old ones, where we have a sense of community and belonging for everyone who's there, which we know that sense of community belonging relates to health and well-being. So there are many things to keep working on, but I do feel more confident seeing the work of the Ottawa Board of Trade, all the partners committed within the city and from across the health sector to do things differently and make positive and lasting change for our downtown core. So I'll talk about budget because I know that's so important and on your minds as we look at couple of reports recently. The city financial services team is kicking off their 2025 budget process. And I know in April, we presented a report recommending that the chair write to the ministry about sustainable funding to grow our inspection related work. And today we're tabling a report about the ongoing pressures from infectious diseases and case and contact management work. The shared theme, of course, being that our public health professionals workload is growing and the resources dedicated to prevention need to grow too. Pendant la pandémie de la COVID-19, les regards étaient plus que jamais tournés vers Santé publique Ottawa. Nous avons reçu une augmentation du financement ponctuel lié à la COVID-19 pour nous permettre de réaliser le travail essentiel pour répondre à la pandémie. But while COVID-19 funding supported the COVID response, funding for our core work has not kept up with inflation or the cost of providing public health services. We continue to feel pressures on our core work in immunization, inspection, climate change, supporting families through our Healthy Babies, Healthy Children program. You see tonight, infectious diseases and mental health and substance use health. So in January, I was pleased that on behalf of all public health units, the Association of Local Public Health Agencies highlighted to the ministry that funding for local public health units is insufficient to meet provincially mandated standards. And as you just heard, we're in a process to review those standards. We'll continue to provide input, and the process in parallel of reviewing the funding formula will likely give us some opportunities again to speak directly about that connection, the resources to do the required work. The province is aiming to have the funding formula for local public health agencies ready in time for 2026 budget planning, so not this coming year. But over the summer months, we're going to approach the 2025 city budget cycles, and I know it will be important to continue hearing from community members, from councillors, from board members, other health system partners about the pressures that we're facing so that we can ensure we're best allocating our resources and growing to meet the health needs of Ottawa residents. So lastly, this heat that we're facing. The number of extreme heat days and the intensity of heat events you heard before this week is going to increase. It's here, right? And it puts people without access to cooler spaces at greater risk of experiencing heat-related illness. This is a life-threatening event. La ville d'Ottawa vit actuellement une période de chaleur de plusieurs jours. Il s'agit d'un événement qui a la possibilité de mettre la vie en danger. And so based on our escalation criteria, Ottawa Public Health has entered into an enhanced response using our incident command system to enable our team to increase our capacity to support. And we have been preparing for these kinds of events for months. We've been working on that, but at this time we're in an enhanced response. And as part of our standard preparations for an extreme heat event, when a warning is issued by Environment and Climate Change Canada, we work closely with members of the city's Extreme Heat, Cold, and Smog Planning Committee to implement a few actions right now. So, and prior to this week, last week, we were doing some of these too. Really public and direct to partner communications focused on raising awareness about the risks of extreme heat, ways to reduce the risk, and really promoting those local resources like the chair mentioned, the map of places to cool off. And the map now includes locations of publicly accessible drinking water fountains. We're adapting our own services within Ottawa Public Health to support residents at higher risk. And the city is adapting their programs, such as making pools more available and encouraging more outreach services. Again, the 311 service of the city is important to ensure that people there, that the 311 operators have the most up-to-date information to support residents to navigate and mitigate heat risks. And so these are some actions we're taking now, and we're relying on many partners to reach people most at risk. But we know that these measures don't actually change the environment that people are living in and the ongoing risk from hot environments. Especially, I'm thinking of people in high-rise buildings without air conditioning for seniors, which you actually also remember me saying is one of the things that keeps me up at night. Ottawa Public Health right now is actively exploring additional measures that could reduce the risks for those with least advantage. Santé publique Ottawa explore activement d'autres mesures qui peuvent réduire les risques pour ceux qui ont le moins d'avantages. So things like requirements for passive and active cooling measure in new buildings through building code measures. Improvements in access to air conditioning or heat pumps in Ottawa, which could include a maximum temperature bylaw for rental units. We currently require landlords to heat in the winter to a minimum temperature, and we could have similar requirements for keeping buildings below a maximum temperature. Programs at all levels of government are likely needed to provide the financial incentives for property owners to complete retrofits that would include passive and active cooling measures and improvements to energy efficiency. Upstream prevention initiatives like this often take the most effort, but they can make the greatest impact on health and well-being. So this work will continue to be a fundamental component of our strategic plan, creating conditions to live well and thrive. And we'll continue to explore these options with partners and bring you more information in the future. But at this point in time, I do want to speak to the public, I may through you, board, to say that I am asking people to adjust your daily routines to stay cool and well hydrated. Ajustez vos routines quotidiennes pour rester au frais et bien hydraté. Knock on the doors of neighbors who don't regularly have a cool environment to live in. See if they need some help to cope in the hot weather. People who are at risk, who live alone, are older adults, people with severe mental illness and chronic illnesses, pregnant people and young children who may not have, who have barriers to access cool spaces, maybe transportation barriers to get somewhere cool. They may need your support. And take care to keep hydrated when at events. We know this is a busy time of events. Reduce your strenuous activity and watch for signs of heat-related illness, such as lightheadedness, cramps, and increased heart rate or fatigue. Go to a cool place and seek healthcare if more severe symptoms arise. So, Chair, that concludes my verbal report, and I'm happy to take questions. Merci.
Thank you as always, Dr. Etches. Do we have any questions? Member Kavanaugh.
Thank you very much, as always, Dr. Etches, for your report, and it's extremely timely with the heat wave that's happening right now. One of the concerns that's growing is the condition of schools. And I don't know if you've reached out to school boards and had a conversation about that, but they were designed a long time ago, and the month of June is no longer cool, and the new schools are fine. It's older buildings, and I don't know if there's anything that has been done about that, but I'm hearing from both parents and teachers, and of course, on behalf of students.
Yes, I think you're right. That's a population that doesn't have a cool environment during the day. And so schools are on the list of partners we communicate with to promote ways of cooling and to pay attention. I think they're also a sector that we need to look at in terms of requirements for schools and raising the expectations that there would be ways found to create cooler environments for students for their learning.
Thank you, and I appreciate your comment about maximum temperatures, for example, in apartments, because we know there's minimum temperatures that must be met for people who live in apartments, but maximum is not there. And that is obviously a growing problem. So I appreciate that as well. Thank you.
Sorry, the other thing about schools, it's not directly answering your question, but just so you know, that we are fortunate that this week schools are still able to help us with a communication channel to the broader population. Often students are a way to reach families with key information, so we're making use of that channel as well.
Thank you, and appreciate your comments on drowning prevention as well, since that will be a key way to cool off. And it's been very unfortunate that we've had some incidents in the area. I felt it very strongly in my ward. So I appreciate your comments, and hopefully education will get out there as well. Thank you.
Thank you, Member Kavanagh. Member Gower.
Thank you, Chair. Lots of updates. You mentioned we got the overview of the review of standards. Then you also mentioned the funding formula review. Do you have any information on the link between the two? Like, are they going to update the standards and then figure out what the funding should be? Or are they updating the standards to meet a certain funding envelope they already have presupposed? Or are they actually integrating these and just trying to do what's right for health in general? Like any context you can give us?
I'm sure you know I can't speak for the province, but I do know there are many dedicated public health professionals working within the Office of the Chief Medical Officer of Health who want the public health sector to have clear guidance and the financial resources to carry out what's most important to do. So I respect that's their goal. They're trying to make things work together as well. We don't have the final picture of what the standards will be, but I do think there's a recognition that there's got to be some sort of look at the cost to implement them. And sometimes, as you know, right now, when we don't have all the resources to do every last letter and phrase and footnote that's in the standards, we have, the support of the province to prioritize. So that is also another way that there's some flexibility in the standards to implement as we're able or as needed locally with flexibility.
Okay, well, we'll watch this carefully. It's important, and I'll try to put my cynicism aside and be optimistic. I mean, I hope it is obviously with the goal to strengthen public health in Ontario, and I hope that there's funding and resources to support our board, our public health unit, and elsewhere in Ontario as well. Thanks.
Thank you, Member Gower. I always do that. Member Brown-Shreds, please.
Thank you, Dr. Etches, for your report. I'm just wondering with regards to reducing alcohol-related harms. Is there any plan to make resources available to community practices just to be able to collaborate on the work that's been undertaken by OPH?
Tempted to unmute online there. Great point. We always appreciate you raising the need to think about what do local primary care providers and practitioners need to help address the issues and emerging issues. So I'm just looking over to see, I can't actually see Trevor, if we are planning to message anything further on alcohol and perhaps using screening and the guidelines.
We haven't been planning anything specific as of yet, but it's a really good idea. We'll bring it back to the team that does messaging to providers for awareness.
Thank you, Member Brown-Shreves. Member Bannon, please.
Thank you. This is perhaps a follow-on question to Member Gower's question, but I guess I'm wondering, in that view, and I know that the submissions for feedback is closing pretty quickly, but are there areas where we have highlighted we want to see investment, perhaps like healthy growth and development? Is that an area where we could highlight the standards we want to see for that area and what the funding might look like to meet that objective in a place like Ottawa that we could use to submit in order to maybe push the standards and push the funding connection in a way that would be helpful?
Yes, we certainly will be providing feedback about the importance of the early years and continuing to have a mandate and support healthy growth and development. I do think that the mechanism to highlight funding needs that you have before you, tonight to write to the government is probably that's a method that would result in highlighting some of the priorities that need to be addressed. And I think on healthy growth and development, we are on record of asking for more resources. And those follow-up, it's not just a letter, I would say, and maybe the chair even wants to speak to this, but the follow-up includes meeting with ministers and showing them our work. Minister Parsa, for example, has come to visit community hubs to best understand what we're suggesting as new ways of working. If the resources were there, that we could reach more people. So if we're not just asking for more money, we're showing we have solutions that we could help with more resources.
I don't think I have much to add, but just to say that we are leveraging every opportunity. So, Roma, AMO, when we were in Toronto for Alpha, we're really trying to make those proactive connections to reemphasize our priorities, and that will continue. So great. Thank you. Not seeing any other hands. So is this received? Great. Thank you, everyone. We'll move on now to item 8.4, Ottawa Public Health Strategic Plan for 2023-2027, update on the strategic action plan. And we have a delegation from Vincent Martin Schreiber, School Streets Ottawa, joining online first. So you can, if you want to come up to the microphone here. So thank you, welcome, and you have 5 minutes to address the board.
Yes? Okay. Bonjour, hi again. My name is Vincent Martin Schreiber. I have a background in civil and transportation engineering, but also in nursing science. I am currently pursuing a PhD in health science on causal modeling here in Ottawa. I am speaking today on behalf of School Streets Ottawa. We are advocating for kids to have a healthy and safe ways to travel around the city with a special attention on trips to and from school. We are here to share with you on how having a funded school active transportation plan could contribute to some of the key goals of the Ottawa Public Health Strategic Plan. Slide. It's a common scene at, I think it's the next one. Maybe. It's a common scene, a lot of nice pictures, at many Ottawa schools every day, where hundreds of kids and families come at the school drop-off and pick-up areas. The presence of vehicular traffic can impose high stress and risk upon crossing on guards, pedestrians, cyclists. Across Canada, 74% of kids get to school by motorized transportation. And this includes, shockingly, 53% of students who live within a 5-minute walking distance. Slide. Presently, many parents are uncomfortable with their kids walking or biking to school. I think it's the one just before. I've made a mistake. Sorry. So setting the conditions for kids to have safe and active trips to school is putting Ottawa public health strategic goals into action. Slide. This issue was noted by Alex Munter, as you can see, who is the president and CEO of CHIO, and he tweeted in 2022, as you can read, since 2017, 1,029 children have been brought to CHIO's emergency department due to collisions between cars or between vehicles and pedestrians. By 143 kids had to be admitted. Lots of different reasons and circumstances, but making roads safer helps kids keep kids out of hospital. At School Street Ottawa, we often advocate for a solution that has been tried around the world and in Canadian cities such as Kingston, Markham, Mississauga, Montreal, Toronto, and Vancouver. This is to create real school streets. School streets are temporary walking and biking corridors that allow children exclusive use of the road immediately in front of their school. They are specific to each school's surrounding context and adaptable to accessibility needs. School streets can be set up for 30 to 60 minutes during pickup and drop-off times with barricades and supervisors. These quick and inexpensive initiatives have immense benefits for children. They are one of the few urban spaces where kids are safer from the threat of motor vehicles, which is the leading cause of child death in Canada. Indeed, 17 Canadian children were killed while walking in 2020, and many more are seriously injured every year. School streets also reduce localized air pollution, which children are particularly vulnerable to. They reduce noise pollution and increase healthy physical activity. In addition, only 28% of children in Canada get the recommended daily 60 minutes physical activity. School streets have shown to provide social connection and greater independence for growing kids. These benefits translate to better learning and academic conditions. Slide and re-slide, I think. These benefits completely align with the City of Ottawa's priorities on the climate emergency and push forward the visions of the new official plan and transportation master plan. It also aligns with goals number 1, 2, and 3 of the Ottawa Public Health Strategic Plan, which are equity-driven to improve population health outcomes and opportunities. The second one is create the conditions to live well and thrive. And the third one is promote well-being and reduce harms. One school, Tri des Bois in Vanier, has already run a successful pilot with the support of Counselor Stéphanie Plante and the school parent council.
Sorry to interrupt. I'll just note you are at time. So maybe if you want to wrap up quickly.
Okay, so slide. Okay, so our calls to action is the first one is to give priority to kids' health outcomes by voicing support for Vision Zero strategy, which lowers speed limits, low speed road design. Refund the school activity transportation plan, which means developing a framework for city-funded school street program and a few other things. The third one is initiate a no idling bylaw and communications plan at school zones and community centers that would involve measuring air quality at schools and community centers to improve health outcomes. And the fourth one is to prioritize a child's journey to school so that it is protected by the same workplace health and safety measures of road construction workers. That means safe separation from vehicular traffic at all times along walking and cycling routes to school.
Okay, I think we'll have to leave it
yeah.
there, but perhaps some members will have questions for you. I'll also just note that Dr. Etches and I did go to see the pilot happening in Rideau Vanier to take it in for ourselves. So do we have questions? Member Banham, I think you have a legacy hand up potentially. Your hand's up, yeah, okay. Member King.
Thank you for the presentation. Really enjoyed hearing about the impacts. I also observed that pilot on site on the first day. I know that many counselors, when we're thinking about the counselor side, got a briefing on a feasibility study that was undertaken by EnviroCenter on this important issue. And I know that the city is examining the potential of a creation of a school streets policy that will come back to council. And my understanding is that typically there is wide stakeholder involvement, and I would expect that public health would be one of those stakeholders. But really appreciate hearing about the importance of this and the idea of greater funding, because we do know that specific programs like the walking school bus programs have been declining in Ottawa, and we need to have these types of initiatives to ensure that our children are healthy, that they can get to school in a healthy way, and also that they are safe when they are either walking or using active transportation like cycling to get to school. So really appreciate the presentation, and it makes sense to bring that forward for consideration by public health. I just want you to know that there are multiple people who are working on this, including Councillor Plante, who has undertaken that pilot. Thank you, Chair.
Thank you, Member King. Member Kavanaugh.
Yes, thank you very much for your presentation. And I also was able to get out to the site and experience the Safe Street. Appreciate it very much. As a former school board trustee for 8 years, I was involved with the walking school bus program. And pandemic was not kind to programs like that, but I think it's important to promote walking in general, for sure. I really like what Quebec does with the corridor scolaire signs and putting routes in communities to encourage people to understand these are routes for kids to go to school as well. My only concern was with the program, it required police presence, but it's I think it's supposed to have more of a reliance on parent volunteers to make it safe. But when I was there, that was the only thing that I saw was might be difficult to, expand, is that the police were there to make sure that people didn't go on the streets. I don't know if you have any comments on that, because that would make it more difficult to expand the programs.
Yeah, sure, because I guess there's a cost involved and it's difficult to organize. But the way we see it is that's a good measure to start, experiencing, experimenting, this type of measures and improve them. And at some point, we may want even to reorganize some wider components of the transportation plan so that we don't have to temporarily close some streets, some surrounding, so that there is like a safe way to move around the city without risking to have a kid being hit by a car.
No, absolutely agree. I think that's something we have to look at overall in our transportation master plan. Thank you.
Thank you, Member Kavanaugh. Dr. Etches, I think you wanted to make a comment.
Yeah, I just wanted to ask if you can share more of your presentation and the recommendations. I don't know if you had a chance to get through all of them, but many of them do resonate with the common goals we have. And so I'd like to be able to take that back to the team and we can take a look at some things are underway, like the review of the bylaw for idling right now is an opportunity to provide more specific input around schools. And so I think it'd be good to have the details.
Thank you. And as Member King said, I think you may be back in this room in a couple months because Transportation Committee will be considering something in the coming months from staff on this. So we might see you again, but I think there's a number of us that sit on both. So thank you so much.
I will put my transport engineering hat.
Perfect. Thanks for joining us. Okay. Do any members have questions for staff on this item? Seeing none, that the Board of Health for the City of Ottawa received this report for information. Is that carried? Great, thank you. Next item, 8.5, Ottawa Public Health Approach to Infectious Disease Case and Contact Management. We do have a presentation from staff, so we'll give them a moment to get set up. And then we also have 2 delegations.
Thanks. So good evening. My name is Robin Ray. I'm the program manager of our infectious disease case management program. And I'm very pleased to be here to present to you about OPH's approach to infectious disease case and contact management. And joining me is Dr. Trevor Arneson, our Deputy Medical Officer of Health. So with this presentation, our goal is to share with you information about our recommendations, how OPH prevents and reduces the spread of infectious diseases locally through case and contact management, trends and rates of infectious diseases and challenges that impact our work, and how we prioritize our efforts with equity and risk in mind. The report includes 2 recommendations to the board. The first is to receive the information about OPH's approach to infectious disease case and contact management. And the second is for the chair to send a letter to the Ministry of Health to convey 2 things. One is the need to review the funding formula for infectious disease alongside the review of the Ontario Public Health Standards to grow the capacity for case and contact management work. And second, the need to accelerate the development of a provincial infectious disease case and contact management documentation and surveillance tool integrated with the Ontario Laboratory Information System to provide sufficient efficiencies in infectious disease case and contact management work. Under the Health Protection and Promotion Act, there are approximately 70 diseases of public health significance that must be reported to local medical officer of health. Laboratories and clinicians make these reports, or other entities described in the Health Protection and Promotion Act make these reports to OPH. This requirement enables us to respond to and implement measures to prevent or limit the spread of diseases to others and to conduct epidemiological surveillance of these diseases. This work is guided by the Ontario Public Health Standards, provincial protocols, and disease-specific guidance. As you have heard, the Ontario Public Health Standards and some related protocols are currently under review, and OPH has actively participated in any ministry-led reviews, groups related to infectious disease work. Local public health units report to the province on diseases of public health significance through the Provincial Integrated Public Health Information System, a tool which was introduced in 2005. Case and contact management is the cornerstone for OPH's role in controlling the spread of infectious diseases in the community. Case management is the process of ensuring that an individual diagnosed with an infectious disease receives appropriate treatment, follow-up care, and support to prevent the spread of the disease to others. Contact management refers to the process of identifying and monitoring individuals who have been in contact with a person diagnosed with an infectious disease to interrupt further transmission. This work is performed by public health nurses in collaboration with registered practical nurses, data entry, and administrative professionals within the infectious disease case and contact management program. In response to reports of diseases of public health significance, public health nurses assess the individual's symptoms, risk factors, potential for transmission, as well as provide counseling and education on prevention. A key activity within this response is to determine the likely source of acquisition for each infection and to identify potential contacts if transmission occurs between person to person, or identify an environmental source such as food, water, or an infected animal to try to eliminate any ongoing risk to others. Public health nurses also work to support clients of diverse backgrounds in culturally appropriate ways by collaborating internally with our community engagement team and externally with local service providers and community resources. This includes sharing prevention messaging and ensuring collaborative supportive care, using language skills and confidential interpretation services, meeting clients in their home and community, and when appropriate, connecting these clients to post-exposure prophylaxis vaccination at our accessible OPH community hubs. I just need a drink of water. That's right. Infectious disease prevention and control overall in our community is accomplished by many programs at OPH. Working together, this includes epidemiology, the public health medicine unit, immunization and school partnerships branch, and the environmental health branch, whose programs are responsible for infection prevention and control, outbreak management, vector-borne disease management, and prevention of infectious diseases related to food and water. Case and contact management activities are often at the core or the connection point for these programs, leading to the identification of outbreaks and health hazards in the community, or the need for prevention initiatives such as mass vaccination clinics. So in 2023, we had 7,608 confirmed cases of infectious diseases, excluding influenza and COVID-19, that were received by OPH, which is a 6.3% higher than the pre-pandemic average from 2017 to 2019, and 47% higher than the average in 20 to 21 when pandemic restrictions were in effect. While reports of most infectious diseases decreased during the pandemic, many are now increasing or exceeding the pre-pandemic average annual number of reports. This burden of infectious diseases continues to grow in Ottawa due to several factors such as population growth, including immigration, travel, climate change increases in vector-borne infections distributed locally, and a reemergence of some vaccine-preventable infections due to outbreaks occurring worldwide or pandemic-related decreases in population vaccine coverage. While certain infectious diseases may affect some individuals more than others, many have the potential to impact anyone in the community. Exposures can occur at schools and workplaces, in our homes, and while interacting with our natural environment and surroundings. Along with the increase in rates of diseases, there are factors that increase the complexity of and time required to do case and contact management. Lack of access to primary healthcare is a challenge for many residents in our community, particularly newcomers. This, along with social and economic barriers faced by many, result in more challenging case and contact management. For some infections, antibiotic resistance can be an issue that may prolong or increase complexity of case management. While there is the potential for technology to be an asset, in the current state, multiple digital systems are required to complete infectious disease follow-up and create a significant amount of additional work. The continued use of the aging provincial reporting tool is not sufficient to meet many documentation requirements needed to fulfill the provincial guidance expectations and other legislated standards. The Ministry of Health is working on a new provincial reporting tool, but this tool will likely not be available for several years. When workload pressures are intensified by increases in infectious diseases or during large investigations or outbreaks, OPH is not able to ensure that all case and contact management activities are performed to the same degree for all diseases. During these times, the program must prioritize work based on many considerations that include the volume of reports, the intensity of the public health intervention, provincial directives, whether the work is achieved by others within the healthcare system, disease transmission and outbreak risk, disease severity, and potential for negative impact on equity denied groups. Some follow up with people diagnosed with infectious diseases more for the purpose of tracking disease trends in the population and are not passed person to person. In April 2023, an investment in infectious disease case and contact management occurred with a reallocation of 8 full-time equivalent positions. Additional efforts have been taken to improve organizational surge capacity for infectious disease case and contact management work through new staffing models and the alignment of the infectious disease case management and sexual health case management teams together. Experiences learned within the COVID-19 pandemic have also been applied. Given the increasing infectious disease rates in our community, complexity of case and contact management work, and the technical and logistical challenges, a resource investment is required. We need a funding structure that grows with population growth and disease rates and accurately reflects the resource needs dictated by the Ontario Public Health Standards and related protocols for infectious disease case and contact management, enhances our capacity to better support equity denied groups, and enables strategic investments in prevention and public health initiatives to those at higher risk for various infections. OPH is pleased that the Ministry of Health is working towards an improved provincial surveillance tool, as our program would benefit immensely from this. We request that the Ministry of Health accelerate their timelines to provide this tool to local public health units as soon as possible. I thank you for the pleasure of presenting to you this evening, and we welcome any feedback or questions you may have about the presentation or the report.
Great, thank you. I think we'll go to delegations and then to questions to staff, if that's okay. So we've got Dr. Robert Delatola. That online or, oh, you're here, perfect.
So thanks so much for having me here today, and the opportunity to speak to a little bit to wastewater surveillance in Ottawa. And I'm hoping to touch on the impact of wastewater surveillance in Ottawa today. And this is all in the context of wastewater surveillance being no longer funded by the end of July within the province, which includes the wastewater activities here in the city. So wastewater surveillance is a little weird. I thought I would show this. It's basically going into our sewer systems, and it's other things besides weird also, but it's going into our sewer systems to collect samples. And what we do here is we collect the sample at the wastewater treatment plant. It's called ROPEC, Robert O. Picard Environmental Center. And we do this process. And that process allows us to isolate certain targets and understand disease incidence. So this is happening now for COVID. It's still happening, but it's also influenza A, influenza B, RSV, Mpox, measles, and other targets. Ottawa is a little unique, I will say, in that there's really this grassroots, strong collaboration between the city, the university, CHEO, and of course, Ottawa Public Health. And because of that collaboration, there's a little bit of impact that's happened over the past 4 years. Jacqueline's here with us today. This is part of her work from Ottawa Public Health. And the wastewater is now integrated into the respiratory assessment that's being used by Ottawa Public Health. In fact, it's integrated at 40% of the weight of that assessment metric. So it's integrated into Ottawa Public Health metrics. It's also public facing. And public facing, we've seen a lot of information become public facing during the pandemic. Now that we're further away from the start of the pandemic, maybe it's not as valuable, but it's really interesting to hear not only in Ottawa from people who contact us, but all over the world how wastewater surveillance is being monitored. We used to have wastewater being looked at 10,000 times a day in the city during the pandemic. And so it's public facing and it provides that information directly to the public. Other impacts we've seen is that there's impacts on resource planning, health staffing. So what you see on the slide now is this is a communication from Ottawa Ottawa Hospital in terms of referencing the wastewater signal and understanding and having those implications for staffing and for resource management. We don't only see this in Ottawa, we also see this in Ontario Health. We see this at multiple different levels. There's a lot of integration because of strong partnership of the wastewater within this city. Oops, I don't know what I did, sorry. There we go. Another aspect in terms of impact is rapid response. One thing we've seen, particularly here in Ottawa, and this city has really, through its collaboration with Ottawa Public Health, been a leader in a lot of this, is this rapid response of wastewater to take up new signals and provide data when data is missing. We've seen that when we had the tridemic, when RSV was really high, along with flu and COVID within pediatric hospitals. We stood up wastewater surveillance really quickly, and we're going to hear from Marie, who's going to tell you what are the implications of that at the CHEO Hospital. Also Mpox. You know, Mpox was stood up once we had a reemergence of Mpox. We worked really closely with Ottawa Public Health to trace Mpox. We also have examples where we're looking at measles, you know, with potentially declining vaccination rates. We're looking at polio. We're looking at other sort of potentially harmful health threats. And we're able to do this quickly and responsively. And we're able to do this here within the city of Ottawa. I will say that with the program closing, our funding is ending. And there will be a translation to Public Health Agency of Canada. I just wanted to highlight that that's a little bit of a different story. We will lose most of what we're doing. They will report information monthly, and they will not be able to give information on the list of disease targets. So most of what I showed you today, in fact, I would say from my personal opinion, I would put money that all of what I showed you today will be lost with that translation to PHAC. So with that, I just wanted to bring forward to you the idea of there's an urgency to hopefully try to find a way to keep this surveillance, to keep this science, to keep this tool happening within our city. Thanks so much for your time.
Thank you for being here today. We've got a question for you from Member Kavanagh.
Thank you very much. I really appreciate you being here and explaining. Well, we know how valuable this is, but just a reminder, I do have a motion that I'm going to read, but in support of keeping the system as is. It will be transferred to the Public Health of Canada, but it should be more frequent. I appreciate you mentioning that. I think we all watched very carefully daily when things were at their peak, and how we just were amazed at the accuracy of this system. So Is it's absolute, I take it it's absolutely necessary to have it daily? Is that your opinion?
It depends on the target, and then usually I will always give that decision to Vera, to Jacqueline, to their team here. They will let us know, depending on what we're looking at, when they want that information. But because we have those relationships built, we're able to accommodate those requests. But it could be daily, it could be weekly. I've never been asked to report it monthly, though. That I can tell you. Yeah.
No, I get it completely. Thank you so much.
Not seeing any other questions, but again, thank you for being here and thank you for the work you've done on this. I'm certainly preaching to the choir in terms of our support, but it's definitely become a trusted resource for many people in the city. So I'd like to see it to continue as well. Thank you. Okay, we have one more delegation, Mary Teitelbaum.
Good evening. Thank you so much for having me. I'm hoping I can speak a little bit more to the timeliness comment. So my name is Mari Teitelbaum. I'm Vice President at CHEO. Dr. Nisha Thempe was one, you all probably met Nisha through the pandemic. She should be here, but she's off speaking about this in international venues. Chuck Huey, another person who could have been here with more experience than I do. Same problem. You did hear from Rob, which is great. Alex McKenzie, there's a plethora of people who have invested a lot in this. And so at first, if you'll forgive the dad joke, a day after Father's Day, but at first I thought I'd been invited because I am the VP of Strategy and Quality and I'm the Chief Innovation Officer at CHEO. So I figured that's why I'd been invited. And then I was doing my prep and I was looking at the cost effectiveness of this work. And I'll share some of that data in a minute. And I realized that all the cost effectiveness is calculated based on, got to get the words right, medically assisted, medically attended respiratory infections. And that's what the cost effectiveness analysis is all based on. How many kids are needing to see a physician or other provider because of RSV and of course, medically attended respiratory infections. Mari, okay, that fell flat, but that's why I'm here today, is to try to teach you a little bit more about what this means to CHEO. So as mentioned by Rob a moment ago, we had that same framework that you saw for TOH, where we were using this information to make decisions day to day during the pandemic, whether we were canceling elective surgeries, whether we were upping staffing in the emergency departments, how many isolation beds we needed, things like that. So this data has been incredibly important, and 3 to 5 days lead time can make a big difference. In the public domain, our staff were incredibly grateful to be able to make decisions based on this to minimize their risk so that they would still be well and able to come to the hospital. So all of that you experienced firsthand and were at the leading edge of. The incredibly exciting work that is happening now is around RSV. And given that others have used the term RSV, I'm not going to say it out loud because I keep saying the term incorrectly, respiratory syncytial
virus.
Everyone go there. Okay. Virus, but essentially this is the #1 reason for admission in pediatrics. 2% of infants end up in hospital because of RSV every single year. So the good news is there is a way to deal with it, and we do have the Ministry of Health does have a program that at the onset of the RSV season, those that are most vulnerable, both as infants or above 60, are eligible for prophylaxis. However, the wastewater indicator associated with RSV can lead between 12 to 36 days from clinical identification of the virus. And so you can imagine the number of children and elderly that would be eligible if we knew exactly when RSV season had begun. And so that work has happened. Last year for CHEO, it was actually August and not November. And so Nisha, Rob, and others have done that analysis. And with wastewater reporting, in such a way, not monthly, but in such a way that we could actually identify the onset of the RSV season, we would save 950 MARIs and we have the numbers here, 250 fewer hospitalizations a year in the province of Ontario, which totals about $3.9 million of cost savings. And as you can imagine, the stress to those families whose children end up in our ICUs, in our pediatric intensive care unit because of RSV. And so just a few examples of why we're so excited about this work. The fact that COVID was just the beginning of it, and things like RSV are introducing even new opportunities to use this information to improve healthcare delivery in Ontario and around the world, of which CHEO is very proud to be a part.
Thank you so much, Mari. Any questions? Member Banham.
Sorry, Mari, I had to.
It's okay, please.
This will bring in your CIO hat and your strategy hat, because I think what we see in the province is a rising concern over health human resources. And we also heard from the staff presentation that there is a digital interoperability problem where there are so many digital tools, they're not interoperable, and it's making it more difficult to get good data. And so what I hear you saying is that this tool is good data. The users and the end users want to see this continue, and it is saving MARIs, which I always like to hear. And so I guess what I'm asking, if you take the health human resources that tools like this help to reduce the pressure on, and you see a tool that is a digital tool that people want to use, what is the benefit for communities like Ottawa? And what would that be like for the rest of the province as well?
I just want to make sure I understand the last bit of that question. So this technology actually leapfrogs the need for the interoperability. So we know that we're working as a province really hard, and I am the CIO at CHEO, so I live in the interoperability world a lot. And so sharing data across jurisdictions where those lab results, for example, through OLIS is incredibly important. But what's so great about the wastewater intervention is it actually doesn't depend on that at all. That by triggering the RSV prophylaxis program broadly based on this data, it's more about reaching those vulnerable infants, which we can now because we have enough technology to know who our patients are. I just want to make sure I got the second half of your question. I feel like I missed that.
I guess it's just that plus the reduction in staff needing to see the MARIs, right? Or being MARIs. It just seems like these tools are what the province should be going towards to meet those goals. And so maybe you could bring in some of that strategy lens and share that perspective.
Thank you for the clarification. So yes. So the prophylaxis program involves immunization for those most vulnerable. It actually keeps those kids, I'm going to focus on the kids because that's who we know, out of our emergency department. CHEO was built for 150 patients. The emergency department space, we're seeing upwards of 250 and higher during our surge season. So if we could keep those MARIs out, because we started the prophylaxis program at the right time and not after these kids are already being seen and lab confirmed, then that frees up that emergency department staff to deal with all of the others and actually avoids the disease at all based on the prophylaxis. So it's really from a strategic perspective, why wouldn't you do it? To protect the staff we have, to care for those that need it and avoid disease that is fully avoidable, but depends on that start date to be available to those that need it.
Thank you.
Thanks.
Thank you, Member Banham. Member Kavanaugh.
Yes, thank you, Chair, and thank you very much for showing the perspective of CHEO, because I think that's really important, because the fact that we're talking about infectious diseases and kids are quite vulnerable for catching anything, and the fact that we need that heads up. So is it preventing the spread? Because I think that's a key thing. Like when you think of childcare centers or just kindergartens or anything where kids are touching each other and So is that part of it, that it's preventing that spread?
Exactly, because if you're getting the prophylaxis, you're not getting the disease and therefore not able to spread it, is my understanding. I have to be clear, I'm not a clinician. I wish you had Nisha or Chuck and others who could speak to that more diligently than I could. But in principle, the more disease we avoid, the less contact tracing we're doing based on the previous presentation, the less hospital resources we're using, and the less transmission and the less burden of disease.
And it's necessary to have it more frequently than a month?
Well, right. Imagine if you miss the month, right? So if it starts August 27th and you do your testing on August 26th, then you're not getting it again until September 26th, and you've lost a month's worth of time where that prophylaxis could be applied and data could be collected and children could be protected. So you've lost 4 weeks of lead time, or 4 weeks minus a day of lead time if your timing happens to be off.
Yeah, no, and I appreciate it very much. And of course, it's the same issue with older adults or.
Absolutely.
Okay, thank you.
Thanks.
Great. I'm not seeing any other hands up, but thanks again for being here. I appreciate it.
Thanks.
Okay, so we'll invite staff back up for questions, but Member Kavanaugh, did you want to read in your motion, and then members can ask questions to staff or comment on the motion?
As you wish. It's a long one. Whereas the Ottawa Board of Health has requirement under Ottawa Public Health Standards to conduct population health assessment and surveillance regarding infectious and communicable disease. And whereas ongoing local wastewater testing for infectious diseases has proven to be a valid, near real-time and reliable method of unbiased public health surveillance and a leading indicator of community transmission. And whereas wastewater surveillance has been central to Ottawa Public Health, OPH's respiratory dashboard, providing insights into the prevalence of COVID-19, influenza A and B, and respiratory syncytial virus, RSV, in Ottawa, and could be expanded to monitor future new health threats. And whereas information from wastewater surveillance has been critical in keeping Ottawa residents informed to guide their risk-based decisions and allowed OPH and healthcare partners to implement early public health interventions such as additional infection prevention and control measures, hospital capacity planning, RSV prophylaxis for at-risk infants at CHEO, promoting vaccinations to higher risk populations, and encouraging residents to take appropriate preventative precaution. And whereas wastewater surveillance is cost-effective and efficient, particularly for detecting infections in the population, regardless of whether the infection is laboratory confirmed. For example, the data captures information from infections in people not eligible for testing with mild illness who don't seek care, and for people who lack access to primary care and testing. And whereas Ottawa's wastewater collection and treatment system covers more than 90% of Ottawa's population, making it ideal for wastewater surveillance. And whereas the Ministry of Environment, Conservation and Parks is terminating Ontario's wastewater surveillance initiative by July 31st, 2024. And whereas Ottawa Public Health and the City of Ottawa staff have had a long working relationship with the University of Ottawa, the Ontario Ministry of Environment and Conservation and Parks, and Ontario Ministry of Health that have optimized wastewater testing and surveillance in Ottawa, enabling Ottawa to be a leader in demonstrating the added value of wastewater surveillance for public health. Now, therefore, be it resolved that the Ottawa Board of Health direct the medical officer of health to work with local partners involved in wastewater surveillance to write to the Ontario Chief Medical Officer of Health, offering support and encouragement, collaboration with the Public Health Agency of Canada's Chief Public Health Officer and Chief Science Officer regarding the continuation of wastewater testing at the University of Ottawa, and that the Ottawa Board of Health direct the Medical Officer of Health to work with local agencies involved in wastewater surveillance to write to the Public Health Agency of Canada's Chief Public Health Officer, and Chief Science Officer, offering support and collaboration to maintain wastewater testing at the University of Ottawa.
Thank you, Member Kavanagh. So we'll go to, oh, actually, right before we do that, we have a motion from. Oh. Oh, okay. We have to deal with your motion before we can introduce a motion to go past the time. So do we have any questions on Councillor Kavanagh's motion? Member Gower.
I can do this. I can do this quick. I'm glad to see the motion. Do we know how much the cost to do this in Ottawa alone is? And would it be worth looking at just funding it from OPH? Why aren't we just funding it through OPH?
Thank you. I haven't done any independent assessment of the cost of running a system, but I know we've worked in great partnership, and I trust the numbers coming from Dr. Robert Jatola. 370,000 is about what it costs to maintain sampling 7 days a week, reporting 5 days a week. And I gather that it would be about 230,000 to sample and report 3 days a week. I think I didn't suggest that we simply cover this out of the OPH budget, because we already are oversubscribed in what we're supposed to be doing with the resources we have. And we do have an offer on the table for the Public Health Agency of Canada to support ongoing wastewater testing. I think the approach before you today in this motion is to try to make it fit what we need, because the current approach suggested reporting once a month won't meet our needs. I think if that those conversations, the letter writing and conversations don't help get what we need, I do think this is a valuable tool. We want to look at other options for maintaining. And I think you can hear from Mari that hospitals use this data. Decreasing 250 hospitalizations at CHEO, there'd also be hospitalizations in the older adult. So I have raised this with Ontario Health, which funds the healthcare system, funds hospitals. Bring it to their attention is something of value for the money in the Ministry of Health. So I think we'll continue to pursue options. The goal is to maintain the system, and that's why you have the motion as it is today.
Okay, thank you. And that amount you gave was a yearly amount, or the amounts? Okay, thank you. Thanks for the additional context, and I think that's a good approach for now.
Thank you, Member Gower. Did not mean to rush anyone. Does anyone else have any questions? No. Okay. Is the motion carried?
Carried.
Okay, great. Thanks, everyone. Now we have a motion from Member Carr to extend the time of the meeting.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Great, thank you. Okay, back to questions to staff. Member Gower, is that a legacy hand, or? Member Bauer, please.
Thank you, Chair, and thank you, staff, for it's a very comprehensive report, very rich in detail and its breadth. Some of the numbers raised are surprising. I worked in community in the HIV/AIDS field for many years, and when I saw the number of HIV infections last year, 133. I think when I left the field, we were averaging 60 to 70. It had plateaued for a number of years. So very much appreciate the pressures that the system is under. I was wondering if you could give us a bit more sense of what the critical gap is between the resources we have and the workload. The report implies that we're not meeting provincial standards. Are we way behind? Is it sort of a narrow gap, or do you sense that it's progressing to a crisis point? And maybe some of the impact just on our community clients that are using our testing services.
I'll take that one. So when we talk about meeting the standards and compliance, it's not as black and white as it might sound. So there isn't a threshold of meeting the standards. It's probably better framed in terms of risk. And I know you had the Board of Health risk retreat where you were talking about risk tolerance and so on. And you have all of these pressures adding on, and so that creates situations where you have individual disease risks that in the past were managed quite easily, and there was no concern that there would be a negative outcome that could have been prevented. But when you have multiple pressures caused by population growth, travel is a big one when you're talking about HIV and newcomers to our country, often with complex medical situations and social situations. Managing these can take a lot more time individually, and that adds up overall. So there's not going to be a point where it's clear that there's a crisis moment. And that's why we want to bring it forward today to make the board aware that with these increasing pressures, it's a slow increase over time, and the teams are having to come up with new ways of prioritizing their work to ensure that those critical situations, which happen frequently with diseases with severe outcomes, are managed. And then that might mean that some of the work on managing some of the other 70 diseases on that list, in terms of collecting all the surveillance information that we need, might not happen in a timely way, and so we might see higher risks with some diseases. But certainly there isn't a immediate risk of the most highest mortality diseases and diseases that we need to follow up right away, though the team does have ways of ensuring that those are taken care of.
Thank you. Member Bauer, Member Kavanaugh, please.
Thank you, Chair. I was fascinated by Member Gower's question about, why don't we just pay for it ourselves? But obviously there's a lot of institutions, hospitals that are benefiting from this. But is it beyond that? I'm trying to get a sense if you're, maybe it's the wrong question for you, but who else is using this wastewater testing in terms of for the broader like other cities, et cetera? Are you just focusing on our infectious diseases? I'm asking you the wrong question.
No, that's okay. I think we can ask perhaps Jacqueline, our epidemiologist, if she has some thoughts on who is using the wastewater information right now.
Thank you. Yeah, through you, Chair Kitts. I think we collaborate with other health units in our region in particular, because we know that, some of the smaller ones may not have representative data from their region, nor have the same sort of collaboration and frequency of testing that we've been privileged to have in Ottawa. So I know that many healthcare institutions, health units do refer to our dashboard to see the wastewater surveillance data. And as well, I'm a part of a wastewater surveillance group with the Public Health Epidemiologists of Ontario, where we collaborate on some of the different techniques for reporting and integrating it with our other surveillance measures. Thanks.
Yeah, and I'll just add that surveillance is a big part of all of infectious diseases and the work of case and contact management. Case and contact management is sort of the foundational principle of infectious disease management through public health. Wastewater surveillance is a newer tool, and it's one of the few newer tools to come along in the past 20 years and provide us with new ways of doing things. And we're reliant on a lot of older technological systems. And so that means that a lot of work has to be done manually, and that takes away time from thinking ahead of partnerships and other ways that we can prevent infectious diseases. So the two are related. But what we were speaking about in the earlier presentation was the need for information management systems, but similar to the new technology that's used for wastewater and how that's assisted with infectious disease control.
Yeah, I was surprised that manual was even mentioned, that we're still there in terms of I think that's really shocking. So obviously that's costly on many levels. So appreciate it that you're pointing that out to us. Thank you.
Thank you, Member Kavanagh. Vice Chair DiGiovanni, please.
Thank you for the report. Always very interesting. And sort of building on your piece about case and contact management being foundational, I think if we roll back the clock 5 years, there wouldn't have been a widespread knowledge that was foundational for public health. And so one of our strategic directions is around team wellness. And so realizing that as we went through the pandemic, contact tracing became hard, and there was people that really didn't want to answer questions from the team, and I just wondered, what the pulse was now as the team is following up and doing contact tracing, and frankly how the team's doing. It's been a rough 5 years.
So I think the team's doing well, but I think these ongoing discussions about how to sort of manage the work are really critical, so that the team has the ability to do the work they need to do, but also is able to balance their workload. What was the other part of your question, Tammy?
Well, just, there was certain points, in some of the peaks where, the team's trying to make contact with the public, and that's not being well received. And, sort of wondering if there's a spillover there now that you're contact tracing, not for COVID, but for measles and other infectious diseases. And if there's a receptivity and, with the public as the team is contacting people.
Yep. So communication with individuals can be somewhat of a challenge. People like to communicate via different modes of communication, be it text or web forms. So there is some limitations we have with that to ensure confidentiality and privacy. So we do primarily utilize phone call conversations. We do monitor loss to follow up. It's not quite as high as you'd think, but we are able to reach a significant amount of people through that mechanism. There are particular populations where we do rely on our community partners to help us follow up with them as well if we're not able to, or some clients don't have access to a phone. So we do work a lot with our community partners to try to locate individuals and to speak to them as well.
Thank you.
Thank you, Vice Chair. I'm not seeing any other hands. So that the Ottawa Board of Health receive information about Ottawa Public Health's case and contact management work as outlined in this report in document 1, and that the Chair of the Board of Health send a letter to the Minister of Health to convey the need to review the funding formula alongside the review of the OPHS to grow capacity for infectious disease case and contact management work, and B, the need to accelerate the development of a provincial infectious diseases case and contact management documentation and surveillance tool integrated with the Ontario Laboratory Information System to provide significant efficiencies in infectious disease case and contact management work. Is this carried? Carried. Great. Thank you, everyone. We will go on now to item 9, which is in camera. Member Carr, the motion, please.
Be it resolved that the Board of Health for the City of Ottawa Health Unit resolve in camera pursuant to Section 13(1)A of the Procedure Bylaw 2011-1 to consider the security of the property of Ottawa Public Health with respect to cybersecurity, and that Chair Kitts, Vice Chair DiGiovanni, members Bannon, Bauer, Brown-Cheese, Carr, Chung, Dudas, Gower, Kavanaugh, and King remain in the room, and that members of the Ottawa Public Health Senior Leadership Team remain in the room.
So carried.
Recording stop. Recording in progress.